You are watching Liberty Online TV.
This is Liberty Online TV powered by Orange Sierra Leone. Orange. This is Liberty Online TV powered by Orange Sierra Leone. Orange.
Surprise on the mix.
We dey look for the news we dey around. Log into Liberty TV online. Positively we bring the change. They get the masses involved. We start them everywhere, everywhere. We climb the mountain just to get the news. We go down the slums to get the views. Hi, yeah, hey. Our voices come. Hi, yeah, hey. Credibility, now we ability. News, give the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking, there's a get the power. You count on me, you count on we anyhow. Give the news, give the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking, there's a get the power. You call on me, count on me anyhow. Liberty we ride, like a nigga we fly. Liberty TV there before. Go.
Good morning, viewers. It's Tuesday, the 11th day of February 2025. And so I go welcome on to another edition of the Liberty Breakfast Show, where they come to you live on Liberty Online Television. And we will bring this edition of the Breakfast Show to you. My name is everybody say good morning.
And me, na Al Hassan Kuma. It's a pleasant morning. Want to welcome you to another edition of this particular program, the Liberty Breakfast Show, where they bring you all the very best of information across the country. But of course, today we will look at the performance of political appointees, and also we will look at how they know they perform in different sectors and play a special focus on the Ministry of Health. This plus plenty other issues and inside the program for you. Don't forget you will be part of the program through you send we a message to the number +23274200545, or you drop me a comment inside the platform inside the watch way form.
Alright, well, as another hearing from Al Hassan inside this Tuesday, February 11th edition of the Liberty Breakfast Show today with the council about health issues. If you've been following the Liberty Breakfast Show on Thursday last week, you will notice say we will look at performance of different ministries, departments, and agencies, and we can don't get presidential appointments with the political head, how far they can don't go in terms of performance, way camp and service delivery. And we been get Honorable Abdul Karim Kamara from the APC, and also we been get Honorable Bashiru Siliki, from the SLPP. And inside that program day, Honorable Abdul Karim Kamara from the APC, according to Ram, it be make reference to different audit reports them, where make it been say 3 ministries, then the way in belief say the ministers them not for them at their position right now. And one of the ministries then they will be make reference to that same day we will get the Liberty Breakfast Show was the Ministry of Health and Sanitation. Where according to Ram, the reference and the way it make, they show say performance not don't do well inside the past year then we make it be recommend say the president for sack the minister. Well, after that program there, Liberty Online TV, we got a call from the ministry, who the minister the request for get a conversation with Honorable Abdul Karim Kamara for let go set the record straight on different issues then we in belief say we are not presented well on that day at the program. When at that we they can talk about inside this edition of the Liberty Breakfast Show. So if you get any question for us or comments for me, send them to +23274200545. We're quickly gonna cut for get an update before we can look at that issue.
All right, we're quickly going to court as Detective Police Constable Hassan Bangura don't testify before magistrates Santigi Bangura and the Freetown Magistrate Court number 2 outside the case between Awana to Bangura day before police, and we reporter Maya to share we get more on our report.
Hawana to Hawa Kouma don't appear for the 4th term before Magistrate Santigi Bangura and the Freetown Magistrate Court number 2. For where police alert say it been set fire upon a man wey make it die. The accused detina before the court on 1 count charge wey gets for do with murder, contrary to section 1 of the Offences Against the Persons Act of 1816. According to the particulars of offence na that, Friday, November 22nd, 2024, na back of Lester Peak Junction, na hill station at the western part na Freetown, the accused been kill a man Nabiu Bangura. Detective Police Constable 13274 Hassan Bangura been testifying at court but waiting in nobody's case, and he say in role na for take picture and investigate case. He say in member Monday, November 25, 2024, who say he been witness when they do the autopsy pan Nabiu Bangura in body when a Dr. Owis Koroma been do am na the Connaught Hospital na Freetown. He said before they start for do the autopsy, the late man Nabiu Bangura and family member them be identify the body before the post-mortem team and the investigation team. He said during the procedure, he been take different picture them of the late man Nabiu Bangura in body with in digital camera, and later a return go back na in office, also he go print the picture them and puts them together. And he been present the picture them na court and been tender them as Exhibit F. Magistrate Santigi Bangura be adjourn this case to Monday, February 17 this year and be send the accused Hawana to Hawa Koroma. Go back na the Female Correctional Center. For Liberty Online TV, me na Mariatu Sheriff.
All right, welcome back. It's still Iwaji Liberty Breakfast Show. They come to you live na Liberty Online Television. Now the different platform they must on the watch with this morning. In case you get any question for us or comments for make regarding the topic we they discussed today, you can drop them in the comment section and the different platform them also on the watch. We are telling us today in the program where they can look at the Ministry of Health and Sanitation in terms of service delivery. We get the minister at the studio with we. I telling us say inside last Thursday edition of the Liberty Breakfast Show, we've been discuss performance where it comes to the people and where President Biokinge appointment. And at that program, the Honorable Abdul Karim Kamara, we come out at the All People's Congress APC party. We make reference to the audit reports and we don't they come out. Where according to them, the Ministry of Health, and one way in belief say not done they perform inside the past year then. And according to them, he believes say the minister not for the 9 seats up to this point. Well, today, now a pleasure with the getting students to Maniana at the studio again for discuss service delivery, how far I don't go under Dr. Austin Demby. Good morning and welcome to the Liberty Breakfast Show.
Morning, Mabel. So glad for the
It's a pleasure having you. After so many times we don't try for reach out, forget you.
well, they keep me busy. So
All right. So before we come, for like, I made the clarifications them we want for do specifically on reference them we Honorable Honorable Abdul Karim Kamara be make now we last Liberty Breakfast Show we make reference to just now. Let me just know under your leadership at the Ministry of Health and Sanitation, what don't be the different reforms them where you believe say like improvements at the health sector. Let me just start here and then we can go to the specific references.
you know, thank you so much, Mabel. I really look forward for this conversation because I think, say, I'm not being listening to the broadcast properly, but somebody na Kenema, maybe what na Kenema, we say, yeah, you but it's in, say on radio, on TV. So again, I'll go online and listen to the exchange. Unfortunately, I think say a lot of inaccuracies been there. We feel say I need for clarify. With all due respect to Honorable Kamara, I think they get them wrong on a lot of fronts.
We can't go into them. We can't go
I'll
into
tell you
them.
something. We get the four major components of we work. We
Okay.
quite transformative, and you can get some small indicators of how effective this is. A couple of weeks ago, the one whole Liberian Ministry of Health, including the minister, all the deputy ministers, over 21 directors na Liberia, come by road for can see what you would do na Salo. Now, four major domains I want to talk about. First, primary healthcare, taking healthcare as close to the people as possible. Second, secondary and tertiary care, where you get higher level hospital level care. Third, referral systems. Fourth, health security. And all them four domains here, I think see they get some real transformative change in this country. And they can't change the world they see. Some visible, some not visible, some not systems changes. Now take health security as a good example. The thing of the appointment I asked so that in February 10, 2021. February 14, 2021, you get an outbreak of Ebola in Guinea. Similar location as the 2014 outbreak. We get the potential for ravage the whole region. One case will not report now. One case will not see now. Not by accident, but how we prepare ourselves. Are able to make one phone call. We get the appropriate vaccine them from Geneva. We don't give nobody. Then give you 20,000 doses for protect the frontline healthcare workers. We go inside Guinea, work with Guinea for container. Now, I mean, you don't see one case now. We prevent entry and we ensure, say, if you get entry, you get protection. Now, in the same period, first time where something happened, would you go Atlanta for CDC, US CDC, or go Brazzaville for WHO, or go Geneva for health. Now we don't establish a national public health agency. Not this country. We did look at preparedness, prevention, and response. Now I make deal like today, where you get Mpox. We don't wait for Geneva, we don't wait for Brazzaville, we don't wait for any other country. We say now, so with the team we'll get, we're able for respond effectively. So as we talk now, we don't get a maximum of 20 cases of Mpox. 15 of them don't go home. 5 now they take care of. That's not on the health security front. And I'll tell you something. People then so admire what you do now that when you get Marburg outbreak in Rwanda, they ask Salo, we send 20 of we crack epidemiologists there, then go Rwanda for 3 months. They're able to contain the outbreak, the Marburg outbreak in Rwanda. So then they tell you, waiting will get there. So on the health security front, lower shift focus to primary healthcare. First thing in this country, you get disease-based vertical programs, malaria program, TB program, HIV program, and waiting happen, you did lose sight of the person. So the systems approach we don't take now, so now for break the silo then they and focus on patient-centered care. So all of the intervention, so they did around the person. So we don't say, look now this country, we want universal health coverage. Universal health coverage means say Everybody, all 8.5 million of we healthcare matter. So which you don't get in this country now. So over the years, we don't build a primary healthcare system where they take access as close to the people as possible, such that 85% of the population get access to a facility within a 5 kilometer radius. What you do now for bring quality to that access. We quality work around 4 major domains. One, infrastructure. Infrastructure as in electricity, as in water, as in physical space, as in safety, as in cleanliness. Second, now for ensure so we get the right number and the right caliber and skills mix for ensure we're able to deliver quality service. And a major component of that now staff attitude for look at patient-centered care. Third, the supply chain to ensure that commodities they're available, they're accessible in a timely manner. Fourth, the drugs. Ensure the drugs in there. So then quality domain and they would work on a national level. So we not reach the eight, but you see the dramatic shift, the dramatic changes. So we're necessarily able to drop maternal mortality by more than 60%. We're not the fastest drop in the world. We're not the admiration of the whole continent as to how we're able to do that. Not by accident. Now by waiting we don't do in this country, how we able to take healthcare to as close to the people as possible.
Doctor, like you don't talk about.
So we don't do two of the
yes,
four.
2 of the 4.
Okay,
I just
right.
want to interject and come into you talk about the primary health care.
Yes.
What I think is a key and essential like the health service sector.
Yes.
Wherein you mentioned about issue we get for do with giving support and how people will for access them facilities.
Yes.
So how best you go before digress on that? Whether it's open up, it's clear for let people able to access the health facilities all across the country because you mentioned about 85%. We will not be able to cover.
Yes. So what you would try for the when you say universal health coverage, like I say, one of the major components of that are access. Yeah. So what you would do now for ensure say as you they build a system so you ensure say the folks that are very adequately informed about them. Yeah. And the case now work in progress, not reach the eight. But in them facility so when you go now the facility, you get some expected result that we get for see. For example, we don't able to recruit about close to 8,000 new staff, across the board. For example, first time will not be to get specialists in there. So as you go train there abroad and we train there abroad and then come back. For the first time, we don't get prescribed training. So we train staff there. We in the last few weeks we able to actually see the first 8 OBGYN specialists and we train OBGYN surgeons. We train that salon. And the cool thing about then we'll take the West African College of Surgeons exam. They get 100% pass, unheard of. Now at the same time, we're gonna get a neurosurgeon. We need to build a whole system around. We don't qualify, we're available. So again, then Tiasu then did, but the biggest challenge we'll get now in the country now how to bring all them here together. So first, it's a good example. We get free healthcare. Free healthcare is dedicated to a small group of people: pregnant women, lactating mothers, vulnerable children, people that will recover from Ebola. Yeah. So now that is there for. Now you get a lot of people then we not qualify for that. So the issue now how to provide services for them as well. So what you would try for do now for ensure say you get minimal standards, a charter where they allow people then for access and services for a little fee. But what you would do now for bring them two together within the process of taking something to Parliament, where they bring the free healthcare and slushy, a health insurance scheme, where they allow you for pool the risk and allow people then for able for access care because we all know the sick at the same time. But if we able for pool resources, if one person sick, you're able for cover them by insurance. So if you get slushy and get free healthcare, you don't get the foundation for universal healthcare.
So as the Minister of Health, based on the description where you don't give us so we start the primary health care, for example, are you satisfied with the current status in terms of service delivery at the primary health care?
It's a work in progress. It's a work in progress. We're not there yet. But from where we were, we are dramatically improved from where we were. Yeah, and I think that's what I would say at this point. Because, for example, um, one of the things that we've struggled with, I don't know, this switch from Creole to English, no matter. Yeah. One of the things that we struggle with, we say infrastructure now. You need electricity. Now, all the facility and the primary healthcare units. Now, the electricity, a lot of the facility then they spend over 25% of their income, up to 30% in some cases. They go buy fuel. They chase fuel. They repair generator. Where the baby one can, the baby one come. Where the baby one breathe, the baby one breathe. So what you do now? Now a radical transformation for move from generator or diesel powered in on a reliable grid system to go to renewables. Right now we get 230 facilities. We don't transition into solar energy. And if you go like PCMH now, first time then they wait for ETSA for get them power. Now if you go there, now you get the equivalent of 300 kVA solar panel. This is about 6 months ago. Now we don't up to 800. And within Oladuin and PCMH they need now about 1300. So we don't go from 0 to 800. That means you get 800 kVA generator. They work non-stop. And you use the grid for charge the battery.
As the Minister of Health, you can do like on-the-spot visits. For example, at Connaught Hospital. You don't ever visit there.
Mabel, are they big that for go Connaught? Because it looks like...
No, the reason why they ask, you are aware say basic thing like gloves where patients and they go. Now they provide them for themselves.
That is ancient history. Let's tell you something waiting going on at Connaught now. Yeah? First thing in this country, you hardly ever get oxygen available anywhere. Now people already make acetylene, then welding, and they need to go get oxygen. Now you get an oxygen plant inside Connaught with a pipe oxygen inside the ICU, the best ICU in the country. 9 days now. Not only that, we right in fact as we speak so now, you get a big renovation we go there for get solar panel throughout the whole hospital.
You can pay on the spot visit day where they're not aware. You just go for monitoring.
That'll tell you what. If you go there, you heart will swell with pride. You go to the outpatient department. Go there in it. How the place is well lit, how the place is clean, how it's accessible. That chaos we've been seeing at Connaught, it's no longer there. To the extent now, then they even plant flowers on the grounds of Connaught Hospital. It's transformed. I go there every time. In fact, this afternoon at 2 o'clock, I'm going there with the Vice President to go and see the new burns unit that's being built at Connaught.
So how you go assess the facilities at Connaught? Just like you mentioned, you like when maybe ask whether you visit Connaught or like you before know how things did go on. So how best you go before explain that to the public.
The reason why they struggle with this, because as I tell you, say some of them are not to technical issues. Not to technical issues. Then get the best doctor there. Then get the best critical care.
And then best doctor then they will on the post where they really confess the basic thing like gloves, patients then they provide them for themselves because they're not available.
Listen now. So if you get them kind structured, what you need now proper governance, proper management of the system. Now that not been there before, yeah. But over the past 5 years, from Dr. Kaba in time and right now Dr. Kapua, the governance system na Connaught, it really impressive. Then they do laparoscopic surgery na Connaught now. Then get stroke unit inside it. So in like I tell you before, you get the free healthcare commodities all the supply, yeah. The other side we not get free healthcare. What you don't do now for do a public-private partnership, a PPP model where you get a high-quality pharmacy on the premises, where they allow you for get standardized access to drugs, at a minimum price with the assurance of the quality where you get.
You make mention, say one thing we're lacking na proper governance.
Historically. That now don't fix.
Proper governance has been fixed.
If you go begin say, change this doctor, change this, what they call this, you did miss the point. You dey go downstream of the issue. You get to go upstream and change the management culture. So what mean they work hard for us. Remember them they get strike day. Then they go to a dot in a corner. Yeah? So we see
I
say
still they stick to basic thing them we suppose for the na Connaught Hospital where they use as example this morning. As far as you concern as the Minister of Health,
Yes.
then basic thing in the day na Connaught Hospital.
It-
Example, gloves and even some basic equipment that we dey expect say for day where patients then can go na then can provide them. Because we don't get a whole doctor where clearly don't state say there are challenges within the face na Connaught Hospital where can result to them asking patients and for go providing thing for themselves.
you see you again waiting I'll tell you something. We never get a perfect system, yeah? We dey work towards perfection. But we start with on day now. Again, first thing you dey get one supply a year. One supply from NEMSA a year. This time now, we dey get 4 supplies every quarter. Not to Connaught no more. All of the hospitals, every quarter, we dey make sure so they can get all of the supplies that we they need. Yeah. But what may happen if you go there, for example, you then require antibiotics. Yeah. They make they run out of antibiotics now, the free healthcare pharmacy. Then they refer you to the PPP pharmacy, we're available 24/7 for able to provide that for you. So again, I think so what you want for come back to you get charter, you get needs and thing we need for improve on. Yeah. So for example, waiting at the point for go send somebody for go buy 20 Leon glove now do. Yeah. When you get a PPP pharmacy, we get all of that available. When this person not qualify for free healthcare. So what you would say, why don't you bundle it in a simple registration fee that will get all the component inside it? I think that's an improvement all they look for in our institute.
What the patient they for pay for?
Maybe at the outset that say you get free healthcare. Yeah? Then one and they will not qualify for free healthcare. There has to be a way of paying for it. So what you would do now for just a minimum out-of-pocket payment. And for going at it, go buy gloves for that. We go put that into your minimum registration. We go ensure so you get the canteen and they're available. If you say the healthcare in this country, everything free, can you afford it? You don't think the per capita health expenditure in this country? Honorable will tell you what it is $46 per capita.
All right.
Now with land as well, $46 per capita. Of the $46, honorable they approve $3. Yeah? So me to go spend $43 around the world. We will partner them for put them together for able to get a package for healthcare. You know that the equivalent in UK $5,000 per capita. Canada $9,000 per capita. US $14,000 per capita. Ghana $100 per capita. We $46.
All right.
So now with the stretch that with $46, forget the biggest value for money.
All right, Dr. Austin Dembe, Minister of Health and Sanitation. We come back to you shortly. Let's just introduce we other studio guests. We now the Member of Parliament under the All People's Congress APC Party, Honorable Abdul Karim Kamara. You been in at the studio last week Thursday, and you been make some revelations them where you make reference to some audit reports that we'll go for can look into. But good morning and welcome to the Liberty Breakfast Show. It's a pleasure having you here this morning. All right, so they come back to you shortly. The minister there this morning, purposely, we get a call from him for respond to and make clarifications to issues and maybe make mention to the breakfast show last Thursday. Who say, according to you, the minister and one person where you believe say for loss in seats because you don't believe say don't perform well based on the audit report and we be make reference to. But for clarification purposes, being that the ministry request say they want to get a conversation with you for clear the air on the issues. You'll just come in with the minister again. Let we know exactly what's be wrong with that program where we do on Thursday, where we been get Honorable Abdul Karim Kamara at the studio, where according to you, seen any way it been talk where you believe say need clarification.
Yeah. Thank you very much, Mabel. Thanks, Honorable. I think I look forward for this to this exchange. again, I've not been listening to the live broadcast, but then forward on to me and I follow a small bit. If we say, Honorable Bashir Siliki been there in a hurry, so you're not being able to answer a lot of the questions that we raise. So again, I think say some of the issues where you raise now legitimate issues, but waiting happen for all of them legitimate issues important to provide context. The context been missing, and I think say the context required clarification. So I asked Mabel for an opportunity for come and have an exchange with you, and by perhaps addressing your concerns, and not only address your concerns personally, but also the answer for the public, that the public understand what you do. So again, this is not civil exchange. I mean, we did talk about two co-equal arms of government, and we respect the legislature and we expect the concerns, but they also important for clarify. Say we're not the executive, we're able to implement and just really make it clear, say, the prerogative of the president for appoint or fire somebody. So if we can't find work, we can't help. Me and my family not there, so also I get one bed, one table. I work 18 hours a day, and I think so. What I expect now for people to understand what should they try to do with the limited resources we get. How they expand them, how they provide quality, and if concerns they, no razor and top water.
And then limited resources here we talk about. We are aware say as limited as they may be, the audit reports always don't they highlight side them where the Ministry of Health don't they fail to produce documents for show see when I do certain things, when I don't they go through the reports and everything come out.
Of course. Again, I think so one of the biggest concerns where I get with the interview the last day, now reference to looking at 2023 audit report. This is not 2025, yeah? Because nearly all of the issues we then raise, yeah? First, again, one of the things that I get concerned with the audit process in general. For me, all the side about I don't work in 88 countries around the world. Yeah, when you look at audit reports, you look at context, you look at an effort for solve problems. Yeah, you don't go say no more. This is not the problem. 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 You long list of problems where you see without context. You remember say if I get all of the resources that I need available to me, I'll not be able to solve all the problems as well. But we get a very, very restricted revenue base where they work from. And so based on what you will get, would they try to apply them? Based on your reputation, would they able for garner resources from elsewhere? We believe in we follow able for do what you will do. So again, just generally, all the audits report that I don't see like with the Inspector General, which I do not constructive balance report. This wrong. But you know what? If we not do then so right, we believe say we'll get improvement in the outcomes. What you see in a process report, we not get no relevance or no reference whatsoever to health outcomes. The primary responsibility here now health outcomes, because what can happen if the outcomes right, it shows say the process is right. You can get perfect processes where you invest in number of workshops, number of meetings, beautiful building. If that did not reduce your mortality, you get a problem. So what you mean they do at the reverse engineer with the target and ensure say we get the health outcomes. Then we look at the processes we go allow you forget the health outcome and even improve on that.
So, Doctor, I hope you follow up just like you mentioned. I will do last Thursday, and Honorable been mentioned. See, the Minister of Health, now the less performing minister of the country, and
it's laughable.
You for be fired by the president because you were not able to.
Again, I think say no. I think say important.
Let's just ask the question.
Wait a minute. This is not co-equal arms of government. Yeah. Again, I don't want to begin set the wrong premise. and then you go down the wrong track. Yeah. So I'm not to interrupt you. I just want to say that you frame the question right, because if you don't determine the direction of the question, then it really quite difficult to respond.
I just to build up the foundation.
Okay.
It's
Sure.
not coming from me.
Okay.
That's why I say if you listen to the program, it's coming from honorable.
Yeah.
Based on certain things and way it expects the Ministry of Health for them able to achieve.
Yeah.
And it be lay reference to the audit report.
Yes.
Just like within Mabel asks, within are some of the issues them where you not being okay with, we honorable mention inside that particular program so that we're able for hammer them.
So, I mean, a good example, reference to Connaught and Connaught Hospital, where I see, maybe there will be follow up on anything, not only that, but just hospitals in general. Again, I describe what we do on health protection. I discuss what we do on primary health care. I'm in try for can now to secondary and tertiary care services. So the Honorable referred to from the 2023 audit. Now, if you look the audit properly, you get issues with our findings, then look at the ministry in response to the findings. In a lot of cases, they get resolved that way. But even when you don't get resolved, we don't get 1 year. 1 year of an opportunity for fix them problem indeed. So meanwhile, can begin get a retrospective without any reference to what you see now. So, for example,
So for you, waiting there inside the 2023 audit reports, una don't address them.
We don't address them. We don't address, not only address them, we don't go far beyond that. Like what I tell you about Connaught as a classic example of PCMH or Oladurin as good examples. See what's not happening in 2024. Yeah? With PCMH, look at the energy requirements. With PCMH, go look and see the outpatient department. Then they talk about, in fact, the one thing I get really annoyed about, now within get subject matter expertise, then you try to interject. Somebody they say, we see 2 oxygen concentrators where you get 10 beds, around the place. But wait a minute, what's in an oxygen concentrator? This is not a machine where they bring the oxygen from the air and make it available to the pikin or the baby. Yeah? If you don't get power, if you don't get electricity, they work. So you can get 15 or 20 oxygen concentration machines. If you don't get reliable power, it's completely non-functional. What you don't do, now forget the oxygen machine in there, and then get Y adapter where they allow you to get more than one person benefit from the oxygen concentrator. Not only that, we get pressurized oxygen now available in abundance. We don't need electricity. So for go inside the we begin spend all of the energy they talk about oxygen concentrators, we look at the fundamental of what is the health outcomes of children in this facility. The health outcomes has dramatically improved. So let's not expend our energy on processes at the expense of health outcomes. Because at the end of the day, it's the outcomes that we focus on.
All right, Mr. Minister, let me just bring in Honorable. According to the Minister, the reference that we will make to the audit report for they don't pass that stage there now because in belief say they don't address the thing them within inside that particular document that we will make reference to. And you're not a whole member of parliament, you didn't assign when una they make the laws them of the country. What thing you take for the fact say the minister is here stating that waiting inside that 2020 audit report when I deal with the start, nothing of the past.
Okay. First of all, I want to appreciate the fact that the minister come out for get this kind of a call for this kind of dialogue, and I think this is show some good steps in governance. If this is what we do for our people, then we make sure that the people can become the center of we productivity and the center of governance naturally in the country. Because it means say we respond to their own concerns them. Maybe the minister don't he refer to the audit report and he say, then nothing they don't address. But that also help them for understand say audit reports are not being concerns from audit reports are not just being addressed and they are left okay, we don't address them. For we as members of parliament and the general public, when you address concerns from the audit reports, the auditors therefore also come back and say, this issue has been resolved. Until it is resolved, I don't take it by hearsay to say it has been resolved. But I come and I listen, they make some one or two areas we need to have to clarify. Let's go to Magboka Government Hospital, for example. It talks about employment. By 2023, you get a total number of 17 CHO staffs that we have the two medical doctors already. Out of the 17, only one get PIN code, meaning 16 of them not get PIN code. In Magboka Government Hospital, by 2023 audit report what I deal with, we come out in 2024. There is a nurse, we don't work there for 21 years, we still not get PIN code. So if you tell me you have employed people, I ask myself the question, who has been employed? And this employment we talk about not start yet in 2024. It started way before 2024. Because since it came to the ministry in 2021, there has been recruitment of staffs continuously every year. So how is it that you have somebody else, CHOs, who are principally assisting the two medical doctors, and yet still 16 of them have not been verified? Oh, well, for want of words, is it because they are in the north? Is that
We will come to the minister. We will come to the minister for
you explained everything. Just give me some time to hammer on the point. Secondly, when you go back to 2021, at the time where Dr. Austin Demby take over the ministry, I'm glad he talked about a response from the audit reports. Say, when one of the sad realities we play not able to understand on the audit processes, the auditors do not just go and write the literature. They go, they find out there is a problem in your ministry, agency, or department. They write you respond to them before they publish. You know, some of the challenges that we come in 2023. In 2021, there were contracts awarded under the full view of Dr. Demby. These contracts were awarded to repairs hospitals right across the country. 30% of those funds were paid and no work done. And these have to do with laboratory equipment. You understand? This is in 2021. And up to 2023, these same issues came up again. Nothing has been done. And the auditors, as he heard me say the auditor, they tell us, then they will give solutions. Then give solution in that particular area. They say the ministry need for cancel the contract and the money need for be repaid. They need for write the contract to them. The ministry respond to the auditors and say they write the contractors, you understand, and they write Ministry of Finance. Waiting the auditors and say is no, they're not able to respond to them adequately because waiting they ask them for do not for terminate the contract because out of the contract will be done in just less than 5 weeks. For 83 weeks under in supervision, nothing has been done for all that period. So therefore, the instructions were very clear from the auditors. Cancel the contract. And as I speak, the contract has not been cancelled in 2023. So when you come to 2023 now, you begin to see the constraints in all the laboratories across the country. You begin to understand, say, it is negligent on the part of the ministry where Dr. Austin Demby, they supervise. So therefore, if there is negligence and lack of performance on the side of contractor, and it is under your full view, you understand? It means you are not productive for the ministry. Go to another one. Go again to this issue na Western area. In 2021, it said a total number of 238 vehicles were not accounted for. When the ministry they respond, it say they don't collect the spare keys to the vehicle. What the auditor they ask for is let us see the vehicles. You understand? The vehicles were not there to be seen. Rather, when the ministry they respond, listen to me right now. He say we don't collect the spare keys to the vehicle. The auditors they say no, not to spare key we ask for. We ask for we see the vehicles them. Secondly, everybody knows the laws of CLNC. If you get motor, even your private vehicle, them vehicle have to be licensed. The auditors they say them motor they don't ever license them. Meaning two things. If you not license government vehicle and are new vehicles them, some of them, you not license them, you just make them available for let them thief them. So the auditor is saying, we not able to get access to them vehicle here. You understand? We not see them. You understand? We not know who side them be. Always then tell we but they're not even showing life card of the vehicles. Them. Already they tell what say they don't collect the spare keys. Them. So spare key means a vehicle available. And when the auditor they go for go audit, he wants to see the vehicles live. It tell you say in 2023 in Kenema district, out of over 70 bikes, new bikes, almost 40 is missing. And you know talk about them here in isolation, when or not they write the ministry. They write the ministry responded to the queries. And after the ministry responded, the auditors and tell you say their issues are still not resolved.
So the issue we get for do the 238 vehicles, they still not resolved.
Of course.
There is no answer from the ministry.
None.
This is so patently wrong.
No,
It is so patently
wait.
wrong.
With
all due respect,
let me land.
Like this
let me land.
But again,
I don't take your word. I don't take your word.
You don't
on
have
this
to.
Because
you don't have to. You don't have to.
Will they come to let's just wrap up, Mr. Minister, then you will
we will not have that kind of exchange. I will not
no. What do you mean you don't have that kind of exchange? Again,
I allow you.
You can't allow falsehoods to
we will come to you for response. That make we take note.
Okay. The truth is, I am not creating the falsehood, and this is what I told the deputy leader the other day, that I am not saying what I wrote. This is written by the auditors. And you were given ample opportunity as a ministry to respond. And you've responded, and based on your response, the auditors are still saying the issues are unresolved. And you don't resolve the issues in the studio to say, oh, it is false. If you know it is false, take up your claims with the Auditor General. I am just here to say, this is what is presented by the Auditor General. And I can go on and on and on. The report is not written by me. Yeah? You go to the Jue Government Hospital and even Cottage, they are saying people when they admit them picking them na Cottage, get for go get water na do, including the hospital na Jue. Not to me right time. So I am saying in nutshell, let I just summarize this. Say if already the auditors are right, now anything true and factual, and when me believe in because response we are sent to you, and you the queries we are sent to you, you responded as a ministry, and your response were not adequate. If not true, it means say Dr. Austin Jembi is not good for purpose. That's what I said.
All right,
I have not said anything extra.
Okay.
Continue for the written at the studio. Let me just come over to Dr. Austin Dembi. He make mention of the same audit report we make you there this morning for clarify certain issues. He make mention of the Maboka Hospital issues with PIN code. People way the ministry don't boasted and they employ, but according to the reports, they not get PIN codes. He also make mention of equipment them we not available in some hospitals. He make mention of the challenge where they across the country with the labs them constraints them there. He make mention of missing vehicles. Make mention of the Kenema bikes them we missing and so many other issues then. From the ministry, that information where they inside the audit report, una do address them?
Yes. Simple. So again, I take personal umbrance at the insinuation of the Honorable Member of Parliament. I think he's reading from an audit report, but it's really important. At the outset, I told you that it's important to provide context. Yeah, it's not funny because I think you're personalizing this, and I want to go beyond that. Let's look at the issues. Yeah. Vehicles, 230 vehicles, or whatever that is here, they were not accounted for. Yeah. The audit expects us to bring all of the vehicles from all over the country to bring them over to you.
No, this is just for
Could you
Western
listen
area.
to me, please?
No.
Can I? Again, I think it's being a
because
little bit
the reason why I want to
bordering
clear
on-
this issue
on
of the
unacceptable
vehicles,
if we're going to have a
we know say
conversation.
repeatedly we said
Yeah,
on the
yeah.
radio
So
audit report
can I-
issues don't they come with
yeah.
ambulance that we don't ask for, they know they
Yes,
see them
yes,
at all.
yes,
Repeatedly kid inside audit report,
Yes.
and you say una do address
Yes,
them.
yes.
So you can just
so
unpack
let me
how
just
una
let
address
me
them.
just summarize that. Yeah. They said there were 230 vehicles that were not accounted for. Yeah. So what the expectation is, they want to physically see the vehicles. Yeah.
Which
So
is
if
the
you
purpose of auditing.
Hey, but you have to balance that with what is required. If you take all of the ambulances in this country or all of the ambulances in the Western area and go park them at your building for somebody to come from audit to come and hand count them, what happens? You will be the very ones that will say, we'll call an ambulance, and there was not an ambulance available. So what we said, there were 230 vehicles that were not accounted for. What we went and did as a response to the audit, we set together a team that went and verified each and every vehicle and have a complete log of the VIN numbers, the engine numbers of all of the vehicles, those that are in active service, those that are out for repairs, those that have been completely written off. A complete package of them. We took it back to audit, and here's the other tricky part. They go like, well, you have to pay for us to go back and verify what you told us. Well, come on. You know, what's our responsibility there? We've shown you evidence. We've gone out there and verified all these products. We've told you where they are. And I think it's up to you to go out there and look and see if what we said is right. Because it's just like
the
you
one
said,
they go
stop
audit,
everything,
and they
stop
ask
all
the
your work.
ministry for let una give them money for go verify.
They said we have to resource them. They have like fancy administrative language. Where am I going to get the resource to resource them to go out and verify? Yeah. Where am I supposed? I mean, anything that the honorable minister, the honorable member of parliament, they give us allocations for to use. I don't see any line item there that says we should fund the audit to go and carry on their work. Yeah. So there were challenges there. Again, no, whatever, vehicles are not things that you go hide under the table. They're visible. They're available. But in order for you to look at their verification, you have to bring reason
So,
to the
so is it
table.
that the auditors then request for fund so that they can able for going
This
and do
is
them?
after the fact. After they
They
said,
request fund from the minister.
after they've done their audit and says we couldn't account for these vehicles, we said the vehicles are there. Some of them are in active service. Some of them are ambulances. You don't want them to take all of the ambulances from the field to come and pack them so you could head count them. We go out there and we verify them. You know, you could come out there and do your due diligence and make sure that this is correct or not. Again, I think we have to have some mutual respect in the space that we are around the issues of contracts. A classic example that you talked about. What is the objective? The objective is to get a product available, right? So, as I told you earlier on, we have very, very limited resources to allow us to do what the people of Sierra Leone want us to do. If we have a contract that hasn't performed, we will cancel the contract. But what does that mean for the actual service itself? So what we're looking at, how do we look at alternative ways of ensuring that the service is delivered? For a good example, when we have a problem with a particular contract around supply of commodities, we look at alternative ways to be able to have the commodity supplied whilst we deal with the contractor. You know, talk about PIN codes. You have about 36,000 people in the workforce in this country, yeah, in the health workforce. It turns out close to 15,000 of them are volunteers, quote unquote volunteers. Yeah. The allocation from the IMF and others have a cap on the wage bill. They don't want you to hire more people. Yeah. So what happens is the government has been, through support from Parliament, has been able to allocate PIN codes of a set number for us. So right now, as I say, you know, we have up to about 8,000 positions that need to be filled. But for volunteers alone, not talking about the influx of new people, you have about 10,000 to work with. So what we've been trying to do is to bring a rational approach to this. How do you create some criteria that will allow people to be awarded PIN codes with permanent tenure. And what we've looked at is what are the critical elements that need to be fulfilled, what kinds of duration of service do you need to have a qualification for it, how do you accommodate new people who come in at the top of their game, get some structure and a format and criteria for it before you start allocating things. I mean, if someone has been there for 15 years and a non-performer, does it mean that just because they've been there for 15 years, they're entitled to a PIN code? So we will factor those in, their performance over time, and we'll also make sure that the new people who are coming in, if you're coming at the top of your class, you're given priority in there. So we're bringing rationality to the whole process. It's a complex, convoluted process. It requires human resources, it requires ministry, it requires interviews by the Health Service Commission. Very, very convoluted. We're trying to streamline that and ensure we have the health workforce that we need to be able to accomplish our mission. So again, it's not, they're not doing anything. People are not being hired. You know, if we had the resources and the funds, we'll hire everybody.
So outside the lie they now for say people and they will not get PIN code. You just don't explain where the same result to the fact say there are people who work when not get PIN code.
The people who are working, the people that know in the system will not get PIN code. But what you will say? Parliament not approve if we ask them for what's so funny, Honorable?
Mr. Minister,
Parliament not approve. In an say you get capped because of the wage bill. Yeah? I'll tell you something. Of the $3 that they give us per capita, yeah? Close to 60-70% of that is going into the wage bill. So only about 30-35% is used for all of the services. So if you want to, you could give us all of the stuff. We hire all the people. Then we don't have medicines. We don't have infrastructure. We don't have supplies to run the ministry. So again, it's a hydraulic that we're working on. And my expectation from the Honorable here is to say, how do we help you to be able to deliver on these things in the middle of all of these constraints?
I want to take you back to that response where you give regarding the ambulance then vehicles them where the auditors and ask for. Like I tell you, every year we go through the audit reports, it shows say the ambulance then the minister not able to account for them where the auditors then can go do their work. And according to you, on always want to make it clear to them say the ambulance and they then can go out and check. And you say they can ask for resources for let them go check. If not, who say the ambulance and they because you say some they were even they in operation. So now because their resources and they are not make it available to the auditor them. Now that's make every year we they see then they put now the audit reports about ambulance the way the ministry not able to get accounts for.
No, that clarifies something. I'm going to talk about historical. And it says this last 230 vehicles were they say not available. We go out there and on the spot check their availability. We're able to account for each and every vehicle we're available. One day we did in active service, one day we did in repair shops, one day we did we don't write off. Okay? We make this available to the audit folks. Them say which one have they asked for. We don't provide them for now. Sorry.
Climb the mountain just to get the news. We go down the slums to get the views. Hi yeah, voices down. Hi yeah, give the news, give the views, the tell where you want them. Government issues, democracy, now we not the answer. We human them, girl picking the security power. They count on me, they count on me anyhow. Give the news, give the view, the tell you one time. Government issues, democracy, now we not the answer. We human them, God begin the security power. They count on me, count on me anyhow. We speak free and fearless, inclusive journalism. Oh, speak free and fearlessly, inclusive journalism. Oh. For the news we dey around, log into Liberty TV online. Positively we bring the change. They get the masses involved. Staffs them everywhere, everywhere. We climb the mountain just to get the news.
Alright, welcome back to still the Waji Broadcast Show, Liberty Online Television, and with the minister will respond to the issue we get for do with the vehicles them where the auditors and the inputs and the audit report say missing. Back to you, Mr. Minister.
So again, I know you talk about historical audit report. I talk about the current one. We say 230 vehicles missing. Yeah. So I don't tell you say we don't go out, we don't verify all of the vehicles that were available. Each and every one accounted for, waiting day in active use, waiting day in our garage, waiting with a no write-off. Now assemble all of this, we make it available to the Auditor General office with a written memo to them, and which we hear back from them. Now for say, oh great, fantastic, we don't see this one, we need for go verify, but we not need for give you the logistics support for go do that. And we don't get line item budget for that. So they talk to me PS and say, you don't fulfill your own part of them. You don't give them, you don't answer the question the way they want. You don't turn it over to them. Now up to them now for able to go back again and say which one tell we good enough or accurate enough. But we don't do it part. Again, I think say this now a much more constructive engagement. But again, I don't think say it reasonable for us for stop everything, bring all the ambulance there, assemble in a UU building that somebody can consent. If we do that, we will pay a costly price of people in life.
So for you, the ministry is okay. Una believe say waiting and put at this last audit report. I don't get some.
Yes.
Then
fully.
it just left with the auditors and for go back and check.
Yeah, yes. Again, what's happening in a lot of cases, they look the report just now. They look the report. In a lot of cases, then they say now documentation issues. Documentation
because that's about
issues.
us.
Then they don't
What
go
about
back.
that?
In a lot of cases, they say most of the